Scores of families from across the United States are moving to grand old Colorado so that their sick children can have medicine made from the active ingredient in marijuana. They're calling it Charlotte's Web, a black oily medicine made from pot. The manufacturers say it's low in THC, so it doesn't get people high, but contains a lot of cannabis-type oil. That oil can apparently help reduce the number of seizures in epilepsy patients, and there is documentation to show that it does work. So far, we're told that more than 200 families have moved to Colorado to get the medicine, since federal law prohibits the company from shipping it out of state. Alicia Acuna works Rocky Mountain Newsroom for us and is live in Denver this afternoon. Tell us more about these families, Alicia. I've seen a lot of reporting on this matter.
Yes, Shep, and for the move to Colorado for these families, it's usually the last in a series of desperate measures for these families. Listen to this one mother talk about her son Zakai's life before trying it.
Well, he had 500,000 seizures by the time he was 5. Zakai would average, some days he would have a dozen seizures. At his very worst was 200 seizures an hour.
This is Zakai now. His mother Heather started giving him the specially bred hemp. It's a strain containing a high level of a compound known as CBD, and the seizures stopped. She says before CBD, nicknamed Charlotte's Web, they tried 17 different pharmaceutical medications. It's grown by a group of 6 brothers in central Colorado. They say if you smoked their entire crop, you couldn't get high. They grow it for the families who need it.
They're not for pot, and for most of them, they would rather it not be cannabis or a hemp strain that works for them.
The Stanley brothers have a wait list of 300 families waiting right now.
Yeah, to get people to try to grow it without much THC has proved to be very difficult, despite the fact that these people need it so badly. What do they use to get the medicine into the kids? They don't smoke it, obviously.
No, they don't smoke it, and the compound is in the hemp, and it's extracted from the plant, and then it's given to the usually children, and it's delivered to them through an oil. There's not a lot of research on CBD because under federal law, marijuana is illegal. Many scientists are intrigued about the possibilities, but remain cautious.
There's just not evidence out there that tells us that it's safe, that it's tolerable, and that it's effective in epilepsy. And so I think that research is really needed from that point of view so that we can establish that and keep kids safe in the process as we move forward in developing CBD as a treatment.
And there are small clinical trials underway here in the United States and in Israel. Shep.
Alicia Acuna, live in Denver. Thanks.